Good afternoon, all. Dr. Jared here. Wanted to continue our discussion of the Paleo Cardiologist. We're going to go over pages 73 through 75 and 32 through 36 today. If you're not familiar with the Paleo Cardiologist, fantastic book by Dr. Jack Wolfson, really discussing how to naturally protect your heart, how to have a better overall healthy lifestyle. So the focus points today are a couple of drugs that affect your heart, and then, like I said, so continuing our discussion of food. So why do we talk about drugs that affect your heart? I think a lot of people don't realize the side effects that occur if they don't feel them immediately. So one easy example of this would be pain relief. You know, obviously as a chiropractor, we see lots of people, especially new clients that are in some level of pain, whether that's headaches or back pain or sciatica or whatever. And one of the most common things, and in fact, even some people that are in maintenance, I'll often hear, well, you know, I don't take medication. I just take vitamins and Advil. Now, why do I bring that up? Well, NSAIDs, which is, you know, ibuprofen, Advil, you know, different anti-inflammatory drugs like that, that can be easily purchased over the counter, have one of the highest side effect rates of any drug class. Specifically, if you want to talk about the heart, NSAIDs are shown to raise blood pressure. They're shown to damage your liver. Specifically, a study recently showed that if you take ibuprofen on a regular basis multiple times a week, you have a 76% chance of increasing your or of developing atrial fibrillation, which is something that people get ablations for, they take medications for. But you know, if you don't get that side effect immediately, many people wouldn't even associate the fact that they take ibuprofen on a regular basis with it affecting their heart. Another one, which I think is interesting, so only talking about two of them today, are statins. So most people take statins or cholesterol-lowering drugs to lower their cholesterol, which does lower the number of heart attacks overall. But one thing that I think a lot of people don't realize, one side effect of taking a statin is diabetes, and diabetes is actually the number one risk factor for having a heart issue. So the drug actually can have the side effect of creating a different disease that makes you more likely to have the disease you're trying to prevent, especially when you're talking about preventative medication. Some other side effects of statins, which would make me want to avoid them personally, are developing cataracts. So how many retired or elderly people have cataracts and think that they're just naturally occurring, but really they're a side effect of a drug you're taking? Muscle weakness, again, often associated with aging, can be a side effect of the drug you're taking. Liver and kidney damage, low testosterone, dementia, you know, all these things affect your heart, but they also affect your overall quality of life. So if you're reading, going through this, page 75 talks about the number needed to treat. And this is something that really, for those of you when you're getting physicals or those of you that are on medication, I think this is a great thing to ask your doctors. What's the number needed to treat to actually prevent an event? So for instance, how many people have to take a cholesterol lowering drug to prevent a heart attack? So one of the landmark studies all the way back in 1998, which was indicated in one of the reasons that your total cholesterol number was lowered from 240 down to 200, meaning when you would be prescribed this drug, was a study that showed that you needed to treat 63 individuals to prevent one heart attack. So which, whether you think that's good or bad is really a matter of perspective. But what I think is most interesting is that study was a landmark study and helped millions of people be prescribed cholesterol-lowering drugs. But if you actually follow the research itself, it shows that although there were less heart attacks, there was no decrease in death rate. The group that took the statin had more cancer and more suicide. And if you watch some of the previous posts, you might see why that is. But how could taking that change the number, yet knowing that it doesn't actually decrease your risk of death? So consider that. Now, what can help decrease your risk of death? Well, lifestyle. And I know that this is beating a dead horse a little bit, but you know, if you want to transition to simple things that have absolutely no side effects, If you go to page 32 and 33, it talks about why you should increase or why you should eat nuts and seeds. And it goes through the benefits of quite a few different nuts and seeds. But some of the best takeaways, in my opinion, first of all, nuts are 50% fat by volume, meaning that if you're trying to eat paleo, it really helps keep your carbohydrate count lower. But even though they're high in fat, they're associated with decreased weight, lower waist circumference, lower blood pressure. Just to name a few here, I want to read the list actually. So higher HDL and lower blood sugar. So all things that people are looking for from a prescription could possibly be corrected by simply eating more nuts and seeds in your diet, eating less processed foods. Additionally, almonds and pistachios can increase the good bacteria in your gut that's thrown off from eating, for instance, those conventional meats like we talked about yesterday. For those that do struggle with eating raw nuts, one way to make them easier to digest is to simply soak them in water for a few hours. Another very, very healthy food. So if you remember when you're talking about eating paleo, one of the things that's unique about paleo is that it really suggests that you avoid dairy, yet is very, very pro eating eggs. And a couple of their arguments for eating eggs versus dairy is it says every animal goes after another animal's eggs. It sounds like they're onto something. You hear people, even people that are trying to be healthy, they might eat egg whites because they're trying to avoid cholesterol. But remember, your liver will make more cholesterol whenever there's damage put to the body. So eating less cholesterol actually could just cause your liver to make more. Eating more cholesterol would cause your liver to make less in a really healthy person. So eggs are actually shown to raise HDL. The egg yolk, the part that sometimes people avoid thinking that they should, is high in vitamin A. It's got vitamin D. It's got vitamin E. There's B vitamins, iron, selenium, many other minerals. In fact, you could argue that eggs are similar to a natural multivitamin. So eggs are very important to eat. They're part of a healthy diet. Just like many of these other things with meat, eggs should be consumed from an animal that's healthy, one that's allowed to be outside, free range, eat forage, like eat bugs and seeds and grasses and all that kind of stuff. One easy way to tell if an egg yolk is really healthy is the more fire orange it is, the healthier it is. If you ever been to a restaurant and seen a really pale yellow omelet or pale yellow eggs, likely it's devoid of a lot of the nutrition that you're looking for. So the more orange the egg, and one way to see that in the grocery store is to look at the omega-3 content. The more omega-3 is typically the higher, the more natural its diet, and therefore the more orange it's going to be. So that's not 100% true, but that's a simple test. The last thing on page 35 I want to mention is a health superfood is the avocado. You see it advertised at Subway. You see it, all over the place. It seems like these last few years. But avocado is a very healthy fruit. The type of mono unsaturated fat that's in an avocado is called oleic acid. Oleic acid has been studied and shows that it lowers LDL, raises HDL, and can help with decreasing blood pressure. And really, why does all this happen? It's because your body's healthier. It's your body getting the right fuel or the right food to operate at its best function. Just think of a machine. You want to use the right type of oil, the right type of gas. You want to do maintenance on it. And your body has a very similar concept. So eat the right foods, avoid things that have side effects, and you're typically going to be better off. So remember, tomorrow night is the big seminar. So we're going to do an hour-long seminar on the book, The Paleo Cardiologist. For those that are current clients, we are giving these books away complimentary. Please like, share, and comment, and hope you have a great rest of your weekend. See you tomorrow.